Hello friends, I have come up with this video. In this basically I will be discussing about how to go about with this ongoing super specialty counseling. After my last video, a lot of people actually mailed me as to what subjects to do and how to go about with this examination. I hope it was useful for all of you. And after this results, a lot of people have started mailing me whether what branch they should be taking, whether they should be taking DM or DNB or any specific choice for any particular place, how to fill about those colleges in DM super specialty. So I have come up with this video in which I am basically going to talk about how to approach these counselings. So in my last video I did mention that whenever you are filling the examination form, you are basically putting it two subjects which you are comfortable with, or which the subjects in which you are going to be pursuing the super specialty. And most of the people will actually fill these choices in such a manner that one of the subject will be a very difficult subject, but the subject which they want to take, like for example in endocrinology or rheumatology, and the other subject will be like a safeguard subject wherein there's a fair chance of getting a seat even with a decent rank. For example, a cardiology or a neurology, where you can actually get a seat even with a rank of around 100 to 200 All India rank. So basically, so people are getting confused as to whether to take DNB endocrinology, DNB rheumatology, DNB hematology, or going about with DM neurology or DM cardiology, whether the DNB of preferred subject is wiser choice than DM of safeguard subject. So I would like to tell you that DNB is no less than DM in particular fields, especially like endocrinology and rheumatology, because they are basically theoretical subjects. And when you are taking DNB, actually you are most of the DNB seats are in private medical colleges or private hospitals. So you are quite exposed to new drugs, new medications and recent advances that you are not well versed if you are pursuing DM endocrinology or maybe DM rheumatology from a government hospital, because most of the patients will not be getting the new medications in a government setup. Rather than, a lot of people will be taking recent advances or new medications and new guidelines they are ready to follow, as in private hospitals the patients are quite rich. So there's definitely a superior learning in certain fields in DNB as compared to DM, especially like the endocrinology and rheumatology I did mention. Second important thing is, if you are aiming for a branch where there's intervention involved, like cardiology or gastroenterology, or if there's a lot of clinical skills involved like neurology, it's better to take a college where there's a lot of heavy load of patients, like government hospitals. So because you will this is kind of a training wherein there's a simple rule: the more patients you see, the more intervention you do, is the better you become. And like in fields like endocrinology, rheumatology, hematology, the better diagnostic techniques you have, the better kind of medicines you have, new medicines, the better knowledge you will have, and the better will be your practice when you go around in practicing with patients. So there's a change in kind of thinking as to DNB, what people used to think before. That's not currently the thinking that you should be having while going about with counseling. DNB is quite successful and it's quite readily accepted, because even outside India people have better considerations for DNB, because the examinations are non-home examinations. Yes, they are difficult to crack. Sometimes it takes around 6 months or 1 year to get through DNB, but then extra as compared to DM, because the pass percentage is less. But then it's definitely worth it, because in the end internationally you will be more reclaimed, because you have passed a non-home examination. You are well versed with new medicines, you are well versed with new technology, the new recent guidelines, and you are quite well versed with new diagnostic modalities, and you have actually applied them on patients. So as I wanted to tell that DNB in these subjects is no inferior to DM. And if you are thinking about taking DM of a subject that you didn't like, but you are getting DM in that subject, and a DNB in a subject that you wanted to pursue, but you are quite not motivated because it's DNB, then that's not the choice to be. DNB is quite clinically as sound as DM in these fields. Second important point that people are asking me how to fill colleges. So there has been this mentality about set of colleges that people prefer, and they have been in rank one since long time, ever since this all India counselings have begun. But I would like to tell you that don't go by this blind rankings that people have given. Rather than going by these blind rankings, it's better to take a college where there's a wholesome approach. Now, what do you mean by a wholesome approach? Now, there are some colleges where, for example, in cardiology, there is a very good center for EP studies and arrhythmia specialization, but then pediatric cardiology is just not there, and for pediatric cardiology you actually refer patient to some other institute. Similarly, there are institutes where pediatric cardiology is very good, but then AP studies are not good, the interventions are not that good. So you basically have a good exposure to pediatric cardiology, but then you don't have a good exposure to the adult cardiology or the arrhythmia study. So basically, rather than taking this kinds of colleges where there's a big name for a particular super specialty, or we can say a particular super specialization, rather it's wise to take a place where there's equivalent proportion or equivalent specialty of all the fields. Similarly, for certain fields like neurology, there is pediatric neurology is present in some colleges, and in some colleges pediatric neurology doesn't exist. So if a pediatric patient comes, we have to refer the patient to some other hospital for pediatric neurologist. So rather than taking a college with big name and a college which has a name in one particular kind of subspecialization, it's better to take a college which has a wholesome approach. Maybe not maybe they do not dig too deep into a particular super specialization, but then they have a basic training of all kinds of variety of that specialization. So you need to keep that in mind. Just don't go blindly by what people say. Keep a wholesome approach, because if the basics are good, obviously you all want to end up in a pediatric cardiology or a arrhythmia specialization or a adult cardiology intervention. Some people want to go up with valvular kind of diseases, but then a good base will obviously help you to form a good future. So it's better in DM that you take a college where there's a bit of everything, so that you have exposure to everything. So when you are going out to private practice, you are not narrowed down, and you are not bound to refer patients to some other cardiologist or some other neurologist because you did not have exposure to that particular kind of patients. So that is second important thing. Third important thing is when you are going about with these fields where there's a lot of clinical skill involved, like neurology, like cardiology, or there's intervention, heavy intervention required like cardiology, or maybe say gastroenterology, then you have to take colleges where there's a lot of load of patients, because the more the patients you see, the more intervention you do, the better you become. So I know this kind of attitude where people are a bit afraid of working in government institutes or places where there's a very heavy kind of a load, but you need to get out of that discomfort, and you need to get into this patient rush and crowd if you really want to be a good clinician, because but there's a simple rule in these fields that the more patients you see, the better you become. That's it. So if you have not seen enough patient of one particular disease, then you will obviously be not confident about treating that disease when you go up in a private practice after completing your DM. Second important thing that I want you to know is it's better to take a college at your home. Now that's something which I have come up with, and which a lot of people will not agree. I know there's a lot of bond issues, and there's a lot of other issues by which people actually have preferred colleges, like the colleges in Delhi, they go first, then the Mumbai. But that's not true, because see, after spending time in a particular area, like for say Delhi or say Mumbai or say for that matter Rajasthan, basically you are thinking of practicing in say Hyderabad. It's better you take a college in Hyderabad, start your DM at your home place, because there's other things that get involved when you are practicing your super specialty in your area where you want to practice. You obviously have more exposure to patients, you obviously make patients during your DM time, that helps. Second important thing is you actually get to know how things work in that particular city, because every city has its different demand. Certain city have like, so say capital cities like Delhi and Mumbai, the super specialist actually directly get patients, because patients are very well educated. There's already a lot of brand marketing for super specialization, but in certain cities, especially B grade cities, still there's a practice of referral system that exists, and that network actually is what gets you the patient. So you need to be in that network. Unfortunately, that's how you survive in these kind of cities. So you actually, if you are practicing from your time of DM in these kind of cities where you actually want to practice in future also, you definitely have a better grip of the situation. So unlike what people think, that's not true. If you are planning to start a practice in one particular city, it's better you start your DM from that particular city. That will help you to get acclimatized, and you will be having a better knowledge about situation in the city in that particular field of practice. And near to home, especially in this COVID time, as I said, there's a lot of colleges where routine services have been dismantled, and people are a lot more involved in COVID activities. So that kind of colleges may actually be very detrimental to your career, because you may end up seeing less patients as compared to other hospitals where there's non-COVID hospitals, where people are actually seeing a lot of patients. Because of certain hospitals being COVID, suddenly there's an increased load in non-COVID hospitals, so they will actually see a lot more patients than you have been able to do. So they will obviously end up being a better clinical practitioner than you are. So be very careful about this kind of hospitals. Certain hospitals have been designated as COVID by government, so better not prefer super specialization at these colleges, though it may be light. But then there's a risk of COVID also involved. At the same time, there's less number of patients, so you have less exposure. So these are three important things that I want you to know. DNB is not inferior to DM in certain fields, so don't hesitate to take DNB. Yes, it's time consuming at times. It takes a lot of patience in completing DNB, but then it's definitely worth it. In your private practice, you will be no less or non-inferior to your other batchmates who are doing DM. College selection, I've already mentioned. Don't go by the Fed rules that people have made, set of rules that people have made. The college preferences are not that easy. Prefer colleges as depending on your branch. So if you have a branch, like I said, clinical branches or intervention branches, take colleges with heavy workload, and where there is a wholesome approach, rather than that college being a very good college for one particular sub-specialization. Rather than a wholesome approach is better in your DM time. And as I said, if you are planning to practice in a particular city, it's better to start DNB in that city itself, because the more time you spend in the city, it's better for launching of your career. You will have less inertia, rather than going to one particular city, learning something really good, and then coming back to city and finding that this kind of high knowledge and high research is not actually required for your city, and you actually end up de-learning in your clinical practice. So it's better you start your DM right away in the place where you want to practice. So I hope all of you will be filling the choices very efficiently, and all the best to all of you. And very soon we'll have the choice filling and choice locking coming up, most probably after this case is settled down. So all the best. And if you have any personal doubts regarding where to fill, how to fill, which branch is better, which college is better, you can actually mail me in my email ID that will be present in the comment section. So all the best. I hope you all have a very bright career in future. Thank you.